Hello friends, welcome to a new lecture today. In this, we are going to learn about the MCQs of stomach in surgery. So first question, following resuscitation, patient with bleeding esophageal varices should be initially treated with. See, following a patient with bleeding esophageal varices has come to you. Now, you have already resuscitated the patient. After resuscitation, what are you going to do? See, after resuscitation, we will have to do sclerotherapy. The next step after resuscitation in bleeding esophageal varices is sclerotherapy. Second question. During sclerotherapy by endoscopy, following are the complications except. Okay, you are doing sclerotherapy. Complications of sclerotherapy are. So, first, in the options, if you see, during sclerotherapy, perforation, stenosis and fibrosis are the complications of sclerotherapy, whereas hepatic encephalopathy is not the complication of sclerotherapy. For sclerotherapy, complications are perforation, bleeding, stenosis, fibrosis, stricture of esophagus, mediastinitis and pleural effusion are the complications. Then question 3. A patient presented to the emergency ward with upper GI bleeding. On examination, he had splenomegaly. In the absence of any other information available, which of the following is the most appropriate therapeutic modality? See, there is upper GI bleeding with splenomegaly. It is most probably upper GI bleeding and he has minimal splenomegaly. So it can be anything, right? It can be ulcers, it can be varices, it can be anything. But the most common cause of bleeding, upper GI bleeding, is peptic ulcer disease. Taking upper GI bleeding as peptic ulcer disease as consideration, you should give treatment according to for treating the peptic ulcer disease. So initial drug which you give for the treatment of peptic ulcer disease is proton pump inhibitors. In the options given below, the proton pump inhibitor is intravenous pantoprazole. So in this patient, you give intravenous pantoprazole. Then question number 4. A patient comes with hematemesis and melena. On upper GI endoscopy, there was no significant finding. 2 days later, the patient rebleeds. Next line of investigation is, see, a patient comes with hematemesis and melena and you have done upper GI endoscopy with no findings. 2 days later, the patient rebleeds. Then the next line of investigation is, see, once you have done endoscopy and it was negative, then again if there is repeated bleeding, then second time you will have to do repeat endoscopy. Because sometimes in the endoscopy which was done for the first time, there might be some findings which may be missed. So you will have to advise endoscopy again. Repeat upper GI endoscopy. Preferably early upper GI endoscopy within 24 hours of bleeding will show us the exact site of bleeding in most of the cases. Then question number 5. All of the following are common causes of hematemesis except. So, chronic peptic ulcer, true. It is the common cause of hematemesis. Esophageal varices can cause hematemesis. Carcinoma stomach can cause hematemesis. Pernicious anemia is not a cause of upper GI bleeding. Right? Next. Question number 6. Uncommon cause of upper GI bleed is. So, among all the options, the uncommon cause, see, varices, peptic ulcer, erosive gastritis are common causes of peptic ulcer disease. Peptic ulcer disease, erosive gastritis, and varices are the common causes of upper GI bleed, whereas carcinoma stomach is not a common cause of upper GI bleeding. It's quite simple. In the previous question, see, the two questions are just side by side. In the first question, the common causes are chronic peptic ulcer disease, esophageal varices, and carcinoma stomach. Here, not a common cause is pernicious anemia, because when compared to carcinoma of stomach, hematemesis may be present in carcinoma of stomach, but in pernicious anemia, there is very, very rare chances or no chances of hematemesis. So, in the second question, among the given options of varices, peptic ulcer, erosive gastritis, and carcinoma of stomach, among all these four, carcinoma stomach is least common cause of upper GI bleeding. Next, question number 7. The most sensitive test to detect GI bleeding is. The most sensitive test for detecting GI bleeding is radio-labeled erythrocyte scanning. Among all this, radio-labeled erythrocyte scanning is the most sensitive test for detecting GI bleeding. Selective angiography is used to detect active bleeding. If endoscopy doesn't show the source, even after endoscopy, if you are not able to see the source, then you do selective angiography. But compared to selective angiography, radio-labeled erythrocyte scanning is more sensitive than selective angiography. Then question number 8. It's a clinical question. 45-year-old executive suddenly develops hematemesis at home. 45-year-old executive suddenly develops hematemesis at home. He is brought to the hospital 4 hours later. Then he again has a bout of hematemesis. Total blood loss would be around 2 liters. The most likely diagnosis is. See, there is no positive history except there is hematemesis and blood loss is 2 liters. So if you see the options, here the blood loss is 2 liters. That is massive hematemesis. Okay, and it is repeated and massive hematemesis. That is blood loss is around 2 liters. So if there is massive hematemesis, then it is characterized by esophageal varices. Okay, it is acute and massive hematemesis, then you should think of esophageal varices. Then question number 8. An old man presents to the emergency with a bout of prolonged vomiting with excessive hematemesis following alcoholic ingestion. He is likely to suffer from. An old man presenting to the emergency following a bout of prolonged vomiting with excessive hematemesis following alcohol ingestion. See, first there is vomiting followed by hematemesis. First he has taken alcohol, then vomiting, then hematemesis. So it is classic picture of Mallory-V stare. Mallory-V stare occurs after excessive vomiting. When the patient has excessive vomiting, when there is erosion of the cardia, then there is blood bleeding or upper GI bleed seen. That is, hematemesis is noted. So this is classic picture of Mallory-V stare. Then question number 9. Mallory-V stare often occurs in. So among all these, it occurs in patients who consume alcohol. It is also common in pregnant women, but when you compare pregnant women and patients who consume alcohol, this Mallory-V stare is more common in patients who consume alcohol than pregnant women. So, thank you guys for watching my lecture. Thank you.